Hello, I'm Adam Salati with the eClinicalWorks podcast, and this episode we'll be talking about Helo and the patient portal as well as the Helo app. With me is Dr. Albert St. Clair, a graduate of Tulane University with a master's in public health as well as health systems management,
yes,
and who is also board certified in internal medicine. A lot of credentials for me to remember, but certainly they look very good on your wall here. Dr. St. Clair, thanks for joining us today.
Thank you for having me.
So you actually had an anniversary recently, didn't you?
I did. I just celebrated the 1-year anniversary of my practice.
Congratulations. When was that?
That was in November 2013.
Wonderful. Yeah, not too long ago. Too long ago. Do anything fun for the anniversary?
We had a little party. We may have had some cookies and some wine to celebrate. Yes.
That red wine is recommended by doctors, isn't it?
That's right.
So new practice, relatively new practice. There's a lot of considerations going into just starting out, right?
Mm-hmm.
What were some of the driving factors that led you to start your practice and that went into this whole process for you?
Mm-hmm. Well, I started this practice with a goal in mind to switch the conversation from what I was calling a reactive type of practice, which is what has evolved over the years, and which people which us doctors would set up a practice and wait for people to come in with problems, and we would react to them and we try to fix people up as much as we possibly could, and then we would send them on their way. And that's not really why I wanted to practice medicine. I wanted to practice medicine to be more proactive and make sure that I'm focusing on taking total care of people. So I thought more about being practicing proactive medicine. So that's what has led me to open up this practice here.
And you're engaged in patient-centered medical home as well, right?
Yes.
And that's a big part of, I think,
right,
some of the things that you're doing here,
right,
as well. So yeah, so you mentioned that the patients, your patient experience was kind of something that you wanted to change, the relationship there between the patients and yourself. But you really can't control the patients at all, can you?
No.
Were you ever afraid that you would build it and they wouldn't come?
Absolutely. That was probably my number one biggest fear to setting up a new practice. When I went through the whole process of finding a office and hiring office staff and getting my diplomas on the walls, and I was afraid that I'd just sit down and nobody would show up. So there was a strategy that I employed to make sure that people could learn about what I was doing here, and that involved establishing an online presence.
So what makes this practice different from any other practice?
When I set up this practice, I had really one major mission in mind, and that is to get and keep people healthy. And that sounds rather vague, and so I wanted to really expand upon that. And I have three major underlying goals there. Number one is to focus on the whole person. Number two is to make sure that I provide coordinated care. And number three is something I call cooperative care. The first thing is comprehensive care. As a primary care physician, I'm very much interested in focusing on the whole person. We have specialists who I refer to who focus on their individual specialty, whether it be a cardiologist focusing on the heart, whether it be the dermatologist focusing on the skin. They do those jobs and they do them well. My job is really to help put everything together and provide comprehensive care. The second piece is cooperative care, meaning that I may be a solo primary care physician, but I have a whole team of people who I work with to make sure that if there's something I can't handle, then other people can focus on that. And part of that kind of care involves good communication with other healthcare providers, and so I try to utilize the features in eClinicalWorks to communicate with outside doctors, including sending faxes directly from the EMR instead of having to print things out and then fax things that way. It's very convenient for us to send faxes directly from the EMR.
And tell me about the office itself. I mean, we walked in here, and the office doesn't feel like a doctor's office. I mean, it looks like a doctor's office, but there's something different about it.
Well, with eClinicalWorks, we are striving to become a paperless office. So I started this practice a little over a year ago, and I did not start with any charts. I just started with electronic medical records, and so a lot of the things that we do here are paperless. So we don't have to print things out. We don't have one of those traditional large printers in the office in which we copy files and scan them into our electronic medical records. People will often bring their electronic medical records here with them. Will bring their printed medical records, and we'll simply scan them directly into the into their chart, and then give the originals right back to them. So we don't actually have to worry about handling any of the paper. There.
Smart.
Yeah.
Very good idea.
Yeah, it's great, and that's part of the coordinated care that we try to provide. The last piece I was going to mention is involves what I call cooperative care. Really making sure that the care that we provide here is focused on the individual and not just a patient. It's not just a faceless being that has a problem and needs to be fixed. So we really try to make sure that the care that we provide is respectful of the person's individual preferences about whether or not they want to try alternative types of medicine or focus on more of a traditional approach. So we take all those things into consideration, from the comprehensive, coordinated to the cooperative type of care. That's a very important part of this whole practice.
So it's a three-pronged approach.
Yes.
To the patient's health.
Versus the traditional model, which is that, hey, if you have a problem, here are the solutions 1, 2, and 3. Thank you very much. Have a good day. We try to provide an extra level of care in that way.
Very important in this day and age. Extremely important. How does Helo fit into that strategy? Why is an online presence important to you?
It's very important for a number of different reasons. First of all, it establishes my reputation online and allows me to have a presence there, so that when people are looking for a doctor, that they know they're dealing with someone who is aware of extending care, not just inside the office but outside as well. And then so it's important from a marketing perspective, and having people come in here initially, and also with the continuation of care, and people can actually access their information online and allow them to be better participants in their care.
Very proactive stuff going on all around.
That's right.
We're going to take a quick break, and we're going to come back with more of the eClinicalWorks podcast.
Over the coming year, you will see Helo revolutionize patient engagement by reaching patients where they are with their smart reminders and automated communication. Leading the way is the Helo app, a logical extension of the practice's portal, at no extra charge to you or your patient. 200,000 patients have already downloaded the app. Patients are hungry for better, easier communications with their doctors. Helo will make patient engagement easy and natural for you, marketing your patient while increasing patient compliance and satisfaction. It's so easy to use. No special activation or configuration is necessary on your part. Your patient simply downloads the app and starts accessing the information you share with them via the portal by logging in with the same credentials. Helo can help your patients manage chronic conditions, help them to improve their medication compliance, reach them where they are with the smart reminders and automated communication, and make getting an appointment to see you easier. Help your patients help themselves to online health and wellness with Helo. Find more information at my.eclinicalworks.com.
Welcome back to the eClinicalWorks podcast. I'm Adam Salati, speaking with Dr. Albert St. Clair about Helo, Patient Portal, and the app. So many offices are turning to patient portal type solutions in this increasingly online world, often as a requirement for things like meaningful use. What do you think of the general sentiments of providers, of patients to this new trend? Is it anxiety? Is it excitement?
I think people are very excited about being able to engage with their doctors, not just while they're here in the office, but also when they're outside of the office, and really be able to communicate with me in a secure way is also very important in this day and age in which people's public health information can sometimes be compromised. Having a resource like this to be able to engage with the doctor and know that your information is secure is very, very valuable for people.
Yeah, absolutely. It's a huge concern now with lots of things that are going on in all aspects of our lives, and I'm sure medicine is definitely one of them.
Mm-hmm.
You don't seem to be too anxious about this whole change.
No.
What percentage of your practice have you been able to enable for Patient Portal?
Over 90%.
That is an incredible number. That's,
Yes.
in my experience, is one of the highest percentages I've ever found. How did you accomplish this? What did you do?
Well, in the early beginning of the practice, we've established protocols in which when people come in, new people or people who I've seen before who are new to the office come in, and we enable them on the portal. And so as soon as they check in, they're automatically set up to participate in the health portal.
So you just integrated it into your check-in process.
Right.
That way you make sure everybody gets enabled.
That's right.
Sounds like a good strategy.
Yes, it's really worked out very well, and I think people have really valued that because it's not only a way of communicating, but it's also a way in which people can see their information, specifically their labs. I do a fair number of labs here, and sometimes it's hard to keep track of everything, and having a resource in which people can log on and access that information is extremely valuable.
You know, I'm glad you brought that up, because we've got some more of your numbers here to talk about, and you spoke of labs.
Yes.
4,000 plus unique labs have been viewed on your patient portal by your patients.
Yes.
So to what extent do you rely on this feature to communicate with your patients?
Well, when I see someone for either an acute visit or a chronic visit, and even just for a general well visit, I'm often drawing blood labs here in the office. I send them out. I'm connected with the labs. The labs will send me the results electronically, and they'll be automatically integrated into a patient's chart.
Through the interface?
Through the interface. And what will happen then is that I feel like it's an important thing to then communicate that information back to the patients, and I do so in two ways. Number one is to make sure that they get a phone call from me or one of my office staff members who can reach out to them and say, hey, we have your lab results, these are the findings. And we do that as a way to answer any questions in an immediate, real-time way. And then also we post the information on their portal so that they can access it at their leisure.
So it's more of a augmentative tool
Yes.
for you, because you're calling all of your patients. Now, why is that? Why do you insist on calling all of your patients? Wouldn't you want to use this tool to maybe automate some of the things that go on in the practice?
Yes, that's a good question. There is. I did have that option, and I did think about it, but I decided that the best way to communicate the information would be through a telephone call first, because it gives us an opportunity to explain any abnormal labs that may otherwise not be too concerning for people and for us, and we could talk about that up front before and anticipate any questions before people would look at their labs and say, oh my goodness, this number's off, is that a concern? And we get quite a fair number of people who call with labs that are otherwise not particularly concerning. So then they can go online and see their own lab results and say, oh, well, that's not too bad. So it's an important communication tool, and to have the information for people to look up their information after that telephone call and see their numbers online is a very reassuring thing for people.
Yeah, I guess that's a big part of engaging the patients is educating them on maybe what some of those numbers are, because they can see the numbers now. I mean, I remember, when I used to go to the doctors, it was just, yeah, your labs look good or they don't look so good, or this is a little high and this is a little, but you never got to see it. So now, you're really connecting with the patients. You're giving them that power through information.
There's been a real shift over the years. I've noticed that at once upon a time, in which the doctor was the center of care, in which there was, you just relied upon the doctor to provide the information and have the information. And now we're moving to a new system in which we're empowering people to not only have their information, but to use that information in a way in which they can manage their health. And that's been a fantastic shift for people, because it's made it great for me individually as a doctor, because it's less pressure on me to have to be totally responsible for all the people who I see. And now people are empowered with their information, so that they can say, hey, look, I have this condition, here are the numbers. And they can not only have that in their own hands, in their apps, but they can then track their progress over time, which is extremely empowering to have a way to see which way they're going with their health.
So you heard it here, Helo by eClinicalWorks, at the center of empowering patients.
That's right.
We're going to take another break. We're going to be right back after this. Be sure to join us at the 2014 eClinicalWorks National Users Conference at the Orlando World Center Marriott in Orlando, Florida, October 17th through 20th. We encourage you to book your reservation early and to bring the family with you to this remarkable family destination. Please visit our registration website at specialevents.eclinicalworks.com to book your hotel and register for our 2014 National Users Conference. Welcome back. I'm Adam Salati with the eClinicalWorks podcast, and I'm joined by Dr. St. Clair. We're going to wrap up here today on our discussion of Helo with the patient portal and the app. And Dr. St. Clair, we've been talking a lot about the patient portal aspect of Helo.
Yes.
But it is also available as a free app for Android and iPhone. How do you see these things working in your practice?
Well, first of all, we try to get the word out when people come into the office, and we do that by displaying prominently information about the app itself.
And you have
yes,
you have some tools.
We do.
That you use
here in the waiting room. We have the information prominently displayed, and everyone who comes in, it's at eye level, so you can see it, and everyone who comes in sees this app, and it's a great feature to have in the practice. And they can easily scan this QR scan and quickly and easily download it to their mobile device.
Have a lot of your patients been using that feature?
My front office staff just informed me that about over 90% of the people who come in do see the signs and take notice of it. So it's really a good way, I think, of putting the information out there.
So go ahead.
And furthermore, once they actually download the app, then they put in their username and password, and they can access their information, and it's got a number of very convenient features as part of it.
Such as what are some of the highlights?
Well, they can not only see their labs, as we were discussing earlier, but also they can schedule appointments online and send me messages securely if a new issue happens to come up.
Sounds like a lot of different useful features, and you're putting them into play right here.
I especially like that they can access the information at any time. I mean, not everyone gets sick between the hours of 9 to 5 when us doctors have our office hours. People get sick at all times of the day and sometimes in the middle of the night. And so it's an excellent feature for my practice to have this available 24/7. So when they have an issue, whether it be 1 minute after we close or in the middle of the night, they can go on their app and schedule an appointment or send me a message.
Sounds fantastic. What are the reactions from the patients to all this stuff?
Overwhelmingly, people have been very impressed with this feature, and it lends some credentials to the practice, because it demonstrates to the people we see here that we're very much involved in engaging them and incorporating this technology into the practice, and hopefully providing a higher level of care.
Getting some street cred there.
Yes.
From the patient portal app, Helo app. So I just want to finish up our conversation here today with maybe a look ahead, and find out from you, what do you think? Where do you think you'd like to see Helo go? What do you think your patients want to see out of the app?
Well, I think it's I'd like to have them be able to utilize it more. While a lot of people have used it, I don't think quite as many people have really fully taken advantage of it. So I think as time goes on, people will naturally start using it as we become more and more engaged with our smartphones, and that'll just be a natural outgrowth of things that we're already doing here. And I think furthermore that it's not only a standard of care at this practice, but I think other practices around the country will be using this on a regular basis so that they can incorporate that into their own daily operations. And it's an important feature, and I really do think it's lended some good value to this practice.
And we'd like to hear your stories as well. If you have anything to share about how you've engaged your patients through Helo, the patient portal, or the app, send it to us at podcasts@eClinicalWorks.com. Dr. St. Clair, thank you so much for your time today. It's been a real pleasure.
Thanks for having me.
Thank you. For the eClinicalWorks podcast, I'm Adam Salati.
Hello, this is Greg Casado with the eClinicalWorks podcast. I wanted to thank Dr. St. Clair for his great podcast talking about patient engagement tools, utilizing Patient Portal, as well as the Helo app to reach out to his patient base. Today I'm joined here with Merlin Matthew from our patient engagement team. Merlin has been a trainer here at eClinicalWorks, as well as she's moved on to our patient engagement team. She started roughly about 5 years ago, and just want to bring up to speed. How is things going these days? What have you been working on, Merlin?
It's good. We actually started with eClinicalWorks on the same day, so we have a long history together.
We did.
Good 5 years, huh?
Solid 5 years.
Well, like you said, I started in training and moved to patient engagement, and I work with product management in patient engagement. I primarily work with Messenger and campaigns, so I work with a great team that writes the campaigns, work with development to get them made and test them and bring them to our customers.
Fantastic.
And there's other great products and tools that we're working on as well. That will be unveiled shortly as well.
Fantastic. Well, we have Merlin here today to discuss some questions we have from our users. So the first question we have is from Jennifer in Tampa, Florida. Okay. Now, Jennifer would like to know, really, what is patient engagement? How would you define patient engagement?
Sure, and that's a great question, Jennifer. For me, I would say patient engagement is a movement in the healthcare industry where providers are looking for ways to better communicate with their patients, and same way with patients are looking for different ways to better communicate with their providers. Okay. Also, I think it's using the latest technologies available to allow patients to better manage and have access to their healthcare. From the eClinicalWorks perspective, there's a great number of tools and products that are available to help providers better engage their patients. For example, we have our patient portal, we have Messenger, which a large number of our practices are already using, and there's also the Helo app that's available as well.
All right, so we have a question from Juan in Santa Fe, New Mexico, and Juan would like to know the difference between the Helo app and Messenger itself.
Sure. Messenger and Helo are both great tools that are available to help providers better communicate and engage their patients. Messenger is part of our core product, and using Messenger, currently practices are using it for sending appointment notifications. And the Helo app is a great resource that's available to let patients access and manage their healthcare on their smartphones.
Okay, excellent.
So both are great tools that can be used together or separately to help patients better receive notifications and manage their healthcare.
Excellent. So we've been hearing about this new campaigns item. So what are campaigns?
Sure. Campaigns is something that I'm very passionate about and work a lot with. And for campaigns, they're a way for practices to send automatic reminders to patients, whether they be about preventive reminders, wellness, administrative reminders, and also just overdue test results. We can send automatic reminders to patients about these. So currently, if we take the current practice scenario, practices would need to have a dedicated staff member run registry searches to find patients that need notifications.
Yep.
And it's accepted workflow, but it also takes time from the resources that a practice has. Well, what campaigns will do is once they're activated, it's a 4-step process to activate. Once activated, they will automatically go and find the patients that are qualified to receive a certain message and send out the messages using the modalities that the patient is enabled for, whether they're voice, text, or even portal enabled. It'll contact the patient the way that they want to be contacted.
Excellent. Now, is this something that just your primary care doctors are going to take advantage of, or is this any practice out there can utilize these?
Actually, campaigns are made for all specialties. We do have ones that are catered for primary care, but our goal with campaigns is to help all of our customers, regardless of their specialty, utilize this new feature. So we have ones, for example, for overdue lab and test reminders that all practices can definitely use. And we have ones that are more specialized, for example, like a mammogram screening reminder that only certain practices might use or specialties might use. But our goal is to make it so all of our customers can use them.
Fantastic, fantastic. Well, the next question we have comes from Erica in Ann Arbor, Michigan. She'd like to know, what is the best way to get started with the Helo app?
Sure, the Helo app is very easy to use. First step is to make sure you have a smartphone and download that app onto the smartphone. It's available either in the Apple App Market or the Google Play Market. As a practice, you just need to make sure that your patient is web-enabled to access the patient portal. The first time the patient logs in, they'll have to put in their username and password for the portal, but every time after that, they make an easy 4-digit PIN, and they use that same PIN to access the app every time after the initial login.
Fantastic.
And once they're logged in and their account has been linked, they have the ability to access things like their personal health record, things like appointments, past and upcoming. They'll have the ability to manage their medications and also to manage things like their weight, blood pressure, or even glucose, all from this app.
Fantastic.
So it's a great resource for our patients.
Absolutely. So we've heard about this new concept of this whole QR code check-in. And is this something that's part of the Helo app itself?
Yes, that's actually in the newer version of the app. The QR code check-in is also available. So if your practice has the QR scanner, the patient can just walk into the check-in window, open that component on the Helo app, and check in directly from there. So it's easy, it's convenient, and also help protect the patient's privacy as well in the check-in window.
No names.
Yes.
Excellent, excellent. So we were talking offline about what eClinicalWorks is doing and what your team's been working on to really get our practices up and running with patient engagement tools and products. So there's some neat ideas that you were telling me about what we've been doing, but I think it'd be a great thing we can share for our audience as well.
Sure. From the eClinicalWorks perspective, we're always looking for ways to help our consumers and practices better use the products that we have available on the market today. So for the patient engagement team, we actually have implementation account managers that are assigned to practices to help them better implement patient portal, messenger, and kiosk. So these account managers will work with the practices in providing necessary training and also individualized strategies to help them better use these products.
Excellent, excellent. So it's very similar to the SAM program, it sounds like, after they get up and running with the software.
Right. If you don't have an account manager assigned, you can contact your SAM.
Excellent.
To have one assigned to you.
They'll help transition one for you. Fantastic. So I want to thank you, Merlin, for joining us today on the podcast. I want to thank Dr. St. Clair for his great podcast talking about the way he's using Patient Portal and the Helo app itself. At the same time, we want to make sure we thank all of our users that are sending in these great questions. If you have questions as well or suggestions for the podcast team, please send us an email at podcast@eClinicalWorks.com. Also, if you want to take a look at all of our current podcasts, you can find us on our YouTube channel, as well as we're linked off of eClinicalWorks.com. Once again, I want to thank Merlin for joining me today.
Thank you.
And we'll look forward to our next episode. We'll see you guys later.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.